Hope at last, where Kenya is set to receive its first batch of COVID-19 vaccines on Tuesday, with administration expected to start immediately. The first priority will be given to healthcare workers and other workers giving essential services, such as teachers and policemen. And as Dorcas Wangira reports, the World Health Organization continues to call for vaccine equity, especially with African countries not being able to secure vaccines as fast as other richer countries who are mopping up for their populations.
Kenya expects to receive its first batch of COVID-19 vaccines Tuesday evening, 2nd March, and at the latest Wednesday, the 3rd of March, the Ministry of Health has confirmed. It is a culmination of a long process that began last year, but which was delayed owing to competition for the limited supply, as every country sought to secure vaccines for their own populations. Given the current global demand and shortage of adequate stocks, the government, besides securing vaccines from the COVAX facility, is also sourcing through the Africa CDC, bilateral and private arrangements.
Yes, we are getting the vaccine this week, but a vaccine does not mean ati ikifika hapa sasa siku ya kwanza kila mtu amemalizwa na hiyo, tumemaliza na hiyo chanjo. The world does not have enough vaccines at the moment for everybody.
The COVID-19 vaccines Kenya has acquired from the COVAX facility are expected to be a mix of AstraZeneca, Pfizer and Johnson & Johnson. The arrival is one thing. Before the administration begins, other processes must be followed.
The priority obviously is government to government as far as the manufacturers are concerned. We also have to have indemnities. You know, the government has to indemnify the company that that is bringing the vaccines. So the private sector would also have to have indemnities, you know, so that they can also be able to bring the vaccines here in the country.
But the vaccination will follow the 3 phases given by the government, giving priority first to healthcare workers such as doctors and nurses, then other essential workers such as teachers and police officers in the line of duty. Phase 2 will begin in July 2021 to June 2022. And as more vaccines become available, the plan is to vaccinate 9.7 million more Kenyans in this phase, targeting persons above 50 years of age and those above 18 years of age with underlying health conditions. Phase 3 could run concurrently with Phase 2, depending on the availability of adequate vaccines. The ministry hopes to achieve the vaccination of 4.9 million people, who will include all other vulnerable populations, like those in congregate settings.
We also have a donation of 100,000 vaccines from India.
In Africa, Ghana was the first country in sub-Saharan Africa to receive COVID-19 vaccines through the COVAX vaccine sharing initiative. South Africa, the worst affected country in the continent, delayed an initial vaccination plan using the AstraZeneca vaccine due to concerns about its efficacy against its new variant of coronavirus. The country began its vaccination 17th February with 80,000 doses of the single dose of the Johnson & Johnson vaccine and is now donating its AstraZeneca vaccines. Morocco has rolled out both AstraZeneca and Sinopharm, Algeria Sputnik 5 and Egypt Sinopharm. Rwanda is administering Pfizer and Moderna. Zimbabwe and Senegal are administering Sinopharm. Equatorial Guinea has received a batch of Sinopharm vaccines but is yet to begin giving it to the general public. The World Health Organization has called for vaccine equity, citing it as deeply unjust that the most vulnerable Africans are forced to wait for vaccines while lower risk groups in rich countries are made safe.
We can't beat COVID without vaccine equity. Our world will not recover fast enough without vaccine equity. This is clear. So sharing the vaccine which is being produced is actually the best way to bring lives and livelihoods back to normal.
The Ministry of Health has maintained that vaccines, however, are not a silver bullet, and Kenyans must still observe the containment measures to be protected from the virus. Dorcas Wangira, Citizen TV, Nairobi.